Welcome back to Legislative Lens, People and Policy. I'm State Representative Michelle Badger, and today's episode focuses on an issue that touches family, healthcare providers, educators, and communities across Massachusetts, supporting children and families affected by prenatal opioid exposure and ensuring they have access to the services they need to thrive. Over the past several years, we've made significant progress in addressing the opioid epidemic, but there's still much work to be done to support the children born with prenatal substance exposure and the families who care for them. Early intervention services can play a critical role in helping children reach developmental milestones and ensuring families receive the support they need from the very beginning. Today, we'll discuss the challenges families face navigating these systems, the importance of early identification and intervention, and the role that local organizations and state government can play in improving outcomes for children. We'll also talk about legislation that Representative Kathy Lenatra and I filed, an act relative to early intervention services for children with prenatal exposure to opioids, which aims to expand access to critical early intervention services for children who may be at greater risk for developmental delays due to prenatal opioid exposure. Joining me today is Theresa Harmon, founder and executive director of To the Moon and Back, a nonprofit dedicated to children born with in utero substance exposure and their family, right here in Plymouth. Since 2017, the organization has been a leader in providing support, education, and advocacy for children and families impacted by the opioid epidemic. Theresa is driven and focused to ensure that the families and children whose lives are impacted by prenatal opioid exposure have the support they need to thrive. I'm grateful for the opportunity to have this conversation and to highlight the incredible work being done to support some of our most vulnerable children. So thank you so much for joining me today. Welcome to the podcast, Theresa.
Thanks for having me.
We're excited. So we like to start this podcast off by kind of level setting, and so everybody, our listeners, can understand. And so if you would be if you could start by explaining what is perinatal or in utero opioid exposure and its impact on children.
So it's when a mom uses either prescribed substances such as Suboxone, Subutex, Methadone, or illicit substances such as Vicodin, Oxycodone, Oxycontin for pain, or, as I previously mentioned, medication for opiate use disorder.
And that has obviously an impact on the child as the child is being developed.
Yes. So kids are either born with prenatal opioid exposure, and that just means that they had the exposure but didn't necessarily go through the withdrawal syndrome. If they've gone through the withdrawal syndrome, we say that they have neonatal abstinence syndrome, or more specifically, neonatal opioid withdrawal syndrome.
Thank you for explaining all of that. And so we often hear a lot about children that are exposed and what kind of misconceptions are out there. Can you tell us a little bit about how they do impact the child?
So our agency has done its own research, and there's also emerging research out there that is showing that there's changes to the baby's brain as they develop, and that could be why we see some of the outcomes that we've been reporting on since 2017. Our research looked at around 150 children, and what we found was that compared to their peers, they were at higher risk for developmental, behavioral health, medical, and educational outcomes or concerns. So the kinds of things that we see are things that look like ADHD, things that look like autism spectrum disorder, difficulty with regulation. They can have neurological eye impairment, such as cortical visual impairment. Along with autism, they can have trouble with feeding, avoidant restrictive feeding intake disorder, and just a myriad of other things. And it appears that, based on emerging research, that this may be, based on the timing of exposure, the drug of exposure, and even the placenta and how it filters out some of these drugs.
And To the Moon and Back has really been kind of really pushing all of that throughout the state, making sure that people fully understand. Can you tell us why you founded To the Moon and Back, and what drives To the Moon and Back?
So I in practice have been a clinical social worker for over 20 years. I'm now a psychiatric nurse practitioner. But when we took my oldest son home, who's now in his teens, we found that we didn't have the resources that we needed for him. There wasn't really anyone who could guide us in what we needed. And at home, I was seeing things that I knew weren't typical child development. So we started with support groups. And people just really came out and they, were seeing a lot of the same things that I was seeing in my own family. And they, voiced the things that they felt like they needed to support their kids and their families. And so based on those unmet needs, we built programs around them.
Yeah, can you tell us some of those programs? I mean, the things that you do to make sure that there's community created, and I think the uplifting that To the Moon Impact does for the topic, but also for the community to surround, because you've told me that, and many of your volunteers and your board members have shared that it can be lonely. It can feel like no one else is in that situation with you. And so the programs that you offer are really very important to the development of the family as a whole.
I think what's really unique for our population is that, I think that a lot of families that are raising kids that have developmental delays or, have behavioral health differences, that they often feel really isolated. But I think what is even more difficult for our families is that we're working with a condition that is really still misunderstood, that a lot of the people that they initially turn to for support don't know how to help them. So I think that is really where we came in. So we started with support groups. We've done children's groups since 2017. And so some of those support groups for the kids, they look at things that we know are helpful based on potential deficits for our kids, like sensory play, yoga, karate, things that help with regulation. We have a grant for uncovered medical expenses that's available. We have my favorite program, which is our case management program, which was fortunately funded through the state for the next 3 years. It was initially a 5-year grant where we have clinical social workers who are also parents raising children with prenatal exposure, and they work with families to assess what's going on with them, what the needs of the family are, and then they link them to resources. They can support them clinically, and they can just plug them in anywhere that they need to, and then they help them navigate the systems of care that are sometimes work in silos to get everyone to kind of communicate for the best interests of kids. The other piece of it is we're really integrated, particularly into the Plymouth school system, where the program allows us to go in and observe kids in their classroom, make recommendations to teachers, to sit in on the IEP process with parental consent, which I think is a really unique piece of the program.
Yeah, so that parent helping parents thing must be really important because you're giving that support from somebody who's been through it or is going through it, obviously. But how did that kind of evolve? How did that come from your support groups to being through the state grant, the state funded grant?
So we got to it based on the research that we initially did that showed that kids, had these needs. And then we thought about how can we bridge that gap? How can we make sure that these kids are getting what they need and that they have the best shot at being the best that they possibly can be, and that families have the support that they need.
Yeah, because we all know that the intervention is so incredibly important. What is it? For every dollar you save about $10 roughly in the long term. So the more work that we can do starting earlier and earlier, and that's so much of what you all do, is so crucial. And you also talked about the group programs. I know you've told us about some of the group activities that you do and how you do them as a family or with other families to make sure that these children may not get the opportunity, or if they do have the opportunity, like you said, sometimes they're misunderstood. So how do those group activities work for?
Yeah, so I think it's nice because it's an opportunity for families that maybe don't have the time to sit on just a caregiver support group. It's a way for them to naturally connect, but also for our kids to connect and to be around other kids that, are older kids now. Many of them understand that these kids also were born, opiate dependent or opiate exposed. I can speak from one example where, the child read a book, and after he read that book, we have a book called Sam the Superhero and His Super Life, which talks about being raised by grandparents with prenatal exposure. And that child read that book, and then he looked at their parent and said, oh, so the kids that I've been going to this group with since I was little, they have this, this too. And so I think it really serves to normalize things for them.
And that's crucial, that normalization.
Absolutely. And I just wanted to go back to our case management program. One of the things that families say is that early intervention is the most helpful, thing that they have. But it only goes to age 3. And then our parents, when we interviewed them, described feeling like they, quote unquote, fell off a cliff. They felt, that they really had to fight for services for their kids. It was a war. It was all, these words around really having to fight to get their kids' needs understood and taken care of.
And you are, so obviously right now you're helping the youngest of the young, the first, 3 years or so you're helping childhood, right? But you started out with the small children, and one of the programs you have is the package that goes home with families when they bring a child home that's been exposed. You tell everybody about that and how that works. And you did such a great job when we did our briefing at the State House talking about why each of the items are selected, because this is a different experience when you bring a child home like this.
Yeah, I mean, it came based on not, me going home and my son, the first night we didn't sleep at all. So we were, up the next morning for his first pediatrician's appointment as new parents. And we laughed because we gave him his first bottle. And as they called us in, we realized that the bottle was spilling all over his face because we were so tired and so overwhelmed. So we have care packages that go home with any child that's born with NAS from most of the hospitals across the state: Boston Medical Center, Mass General, BI here in Plymouth, South Shore Hospital, even out in Western Mass at UMass. And so the items are carefully curated. They're things that our families recommend, for instance, like the Dr. Brown's bottle, because a lot of our kids have colic. Or, our kids have a lot of sensory differences. So Baby Balm that has scent to it to hopefully help, with calming our kids. Baby Balm are, because our kids often have some significant GI issues with, coming off of the opioids that they were exposed to in utero. And so they're, more prone to diaper rash and even, bigger sores that we have to take care of. And then we have a zip up swaddle to help with teaching kids early how to regulate when they're upset.
No, it seems like such an important piece, and it's that, again, that community you're creating and that we've got your back and if you need something. So how did you go from, starting in Plymouth and you start this organization? Obviously, you've got families all across the South Shore, but now you're in hospitals in Boston, you're in hospitals in other western part of the state. How did that happen? How were you able to evolve like that?
I think word of mouth, families heard about us. We were doing, since our inception, a lot of training. Originally, it was here on the South Shore, but we started getting asked to train professionals in other areas of the state through DCF. And so just word of mouth, families heard about us and saw our website. And I think just generally, upon first contact, a lot of times we're getting contacted from outside the state too. Families are just Googling, the help, and they're finding us.
Yeah. That's awesome. And then you also have a conference that you bring everyone together to talk about the research. And so I don't know if you want to talk about the conference a little bit and kind of the topics you cover. And I know you're doing amazing research, but we can talk about that.
Yeah, so we have our conference every other year. So we just had our conference last month. We had about 150 people in attendance, and then a good number of people online as well, attending from across the country. And it's a unique opportunity. A lot of people say that they particularly enjoy it because it brings together researchers, it brings together families, it brings together professionals that are on the front line, and it gets them all together to be able to talk about ways to continue to support kids around tangible skills that families can bring home through the different speakers that we have, as well as talking about anything new within things that are being researched as well, to keep families kind of up to date and providers up to date on what's going on across not just the state, but across the country.
I mean, it really just sounded like when I went, I really wish I could have spent the whole day. It was very interesting listening to research that was happening, but it sounds like without you all, without To the Moon and Back, and without the grants received from the state and other areas, there really wouldn't be this research that's being done. You wouldn't be delving this deep and finding finding and creating the community that's being created. So, I mean, you all have really transformed.
Yeah, I think, we're doing our own research right now. We're looking at a couple things. We're looking at caregiver burnout. We're looking at our case management program closely to see what kinds of things are helpful for kids that we're providing to them. We're also trying to get funding to do a look at the diagnoses that kids are getting after their NAS diagnosis, because it is a diagnosis of infancy, and then also the medications that they're being prescribed for any psychiatric conditions, so that we can help families kind of navigate the behavioral health piece. So that's something that I'm really excited to delve into next. And we also affect research in other ways too, like other research that people are doing. Like, for instance, I talked to a researcher at Tufts this week who was working on a really interesting study. And, based on the things that I'm seeing on the ground, she was really excited to think about how she could link her research to something more practical to help families.
Well, I'm sure. I mean, everybody, we're lucky to have you in Plymouth. We're lucky to have you really, and all your board members and all the volunteers really pushing this forward, because it is so important. And like you said, it's the early intervention, getting into the Plymouth Public Schools, and that kind of started off the larger program that you have throughout the state. Do you want to share a little bit about how that program also was able to develop, and how it's gone from, in the Plymouth Public Schools, helping those in the classroom, and now it's all across the state?
Yeah, so the program really kind of evolved. So it was, like I mentioned, a 5-year opportunity for this case management program. And so originally we wrote it that we would work with the Plymouth Public School System, much to their chagrin, because I didn't ask them first.
Oh.
And I just got to give, a kudos to their team there. Chris Campbell was just like, this sounds great. Let's do it, even though he didn't know anything about it before I got the money. And so the plan originally was that they would be a referral source for us, and then we would be able to put the program specific to Plymouth, because we just had such a great relationship with them. Over the years, they've really been open to learning about how to help these kids and what they could do to put in place at the educational level. So I feel really fortunate. But what we found was that other school systems were reaching out to us too, looking for help. So we went back to our funder and we asked them if we could move the program so that it was statewide, which they agreed to. And so we've been working with, a number of school systems across the state now.
And that's great, because then you also do the training where you make sure that preschools understand, because one of the things that I think was most surprising to me, I don't know, maybe 10 years ago, when I learned that kids get expelled from preschool. Who knew that was a thing? And a lot of it is just maybe they don't have the knowledge or the staff development at that point to be able to care and help them understand how to handle their children like this.
Yeah, 100%. And that, there's a couple things that I personally am really proud about with our case management program. And one of them is that we have intervened so that a child didn't get expelled from preschool. So that was a huge win for us. My other, really important thing to me is that mental health services and the access was something that families really talked about struggling with. And I'm proud to say that 100% of the kids that want these services through our case management program have them in place. And most of them, it's through in-home therapy, which is really great.
That's awesome because we know that people struggle to get that. And so being able to say 100% is huge. And so you do all of that, and we've expanded everything across the state, but there can always be more work that can be done. And I know we recently partnered to do the briefing in the State House to make sure that the other representatives from across the state understood these really great programs that you have that started in Plymouth, went to the South Shore, and now are throughout, really were able to do that. And on top of that, we were able to, with Senator Fernandez and Rep. Lenatra, talk about the kind of the work that you have been doing with the legislature. Can you tell us a little bit about the bill and why it is so important?
What we are trying to do is a diagnosis of NAS automatically gives kids eligibility for early intervention. They don't have to screen in. However, what we're finding is that a lot of times, even though kids still very obviously need the services, that around 2 years old, that they all of a sudden are getting dropped from early intervention. Also, there's some errors in reporting of the NAS diagnosis now. And so, kids with prenatal opioid exposure obviously still benefit from, having easy access to early intervention as well, because there's already so many barriers. Families are waiting for the hospital to send the referral over and hoping that they remember to do that. They have a lot going on. Or sometimes the referral doesn't get over, or the family, forgets to kind of follow up. But so anything we can do to make it easier, these early services, as Michelle mentioned, are just incredibly important. And we also wanted to expand it to other substance exposures too, because, fetal alcohol spectrum disorder, their kids, a lot of the things that they experience look exactly like our kids, or, any other exposures can benefit as well. So trying to make the access easier and make sure that kids get what they need.
Yeah. And when you say there's errors in diagnosis, can you explain that a little bit?
So with there's, from what I have seen personally, and I'm sure that there's people that are better informed on this that could speak to it. Sometimes kids go home from the hospital, and instead of a true NAS diagnosis, they might get just the prenatal opioid exposure diagnosis. And however, their kids have gone through withdrawal. And so, to the letter, NAS is any child that goes through the withdrawal process. However, it's not always getting coded accurately. And so that is and can be a barrier to getting these services and future services as well.
Yeah, no, and so it's so important. And we're all three of us are proud to be able to file and work with you on all of that. So thank you for just being the advocate you are and bringing it to our attention. And I know that you are also, and I, would be remiss to not talk about the Arise grant program and all the wonderful work that the Plymouth HHS has been doing with Michelle Brady, and really making sure that we're uplifting and supporting our local organizations that are doing great work. Do you want to tell us a little bit about Arise and
Yeah, absolutely. Yeah, Arise has been wonderful. Michelle Brady always laughs that before she even started her new job that I was knocking on her door because I knew that the funds had been there and that we were waiting for her to be able to start a request for a proposal on the grant money. And to her credit, she, stepped right in and got things going for that process, which has been a process here in Plymouth that other areas of the state have looked to how she has rolled these grants out. Because she has done such a great job with it.
yes.
So we received Arise grants the last 2 years. Initially, it was for our case management program. We got a pretty significant amount of money. But then during that process, Health and Healthy Aging through the state ended up providing us with this 5-year grant. So, but the town of Plymouth saw the importance of the program first and, was right on board there to help these kids here in Plymouth. And then this year, they helped us with funding our conference and with, we did a perinatal parent support group with the Megan Perry group, who Megan is just an amazing advocate for people in recovery and particularly moms caring for kids that were born prenatal opioid exposure and navigating recovery.
Thank you. So we've talked a bit about this, and I think one of the things that now we're going to switch about what do you think To the Moon Impact's next steps are? What are you guys thinking about right now to keep moving forward?
Yeah, so two particular things are on my radar. Obviously, keeping the case management program going, getting more kids into it, trying to let families know that we're out there. The other piece is the other part is looking at the research, or starting to do research looking at, what these kids are going on to be diagnosed with and how they're being treated with psychiatric medication. And then the other piece that we're waiting to hear if we got our RISE grant for this year is taking our perinatal curriculum that Megan developed for us and putting it into an app and then developing some additional modules around when you take your baby home from the hospital, what kinds of things you're going to see and how to best support them, lactation for moms that are breastfeeding, and then on the other end, things in relation to what to look for as your kids get older and how to support them with resources. And so the app will be incentivized for families. Each module they can complete, they'll get a gift card to Amazon because that has been shown to really increase people, completing programs like that. So we're really excited to hopefully be able to see some funding to be able to carry through with that.
Oh, cool. That's awesome. An app. That's great. I mean, again, just continuing to wrap people around and make sure that there's those supports. So from your perspective, working directly with families, where do you see the greatest opportunity for state government to better support this population?
I think really when early intervention ends and families really struggle with who to follow up with, how to follow up, what their kids' needs, I think continued support in realizing that these kids, things don't just end in the NICU. Mm-hmm. That's why, our conference is called Beyond NAS, because it is beyond that diagnosis. Kids go on to continue to have these huge needs that are not being adequately addressed because of a myriad of reasons, lack of education, lack of interest in following through on things because of fear of stigma for both the kids and the parents. And I think, our language around this just really needs to change, thinking about that parents that, abused or were on medication for opioid use disorder, they were just doing the best that they could, to care for their child. Often they can't just stop their use. Otherwise, there's a risk of aborting the fetus and more significant outcomes. And so I think our focus really needs to be on changing that narrative and there's always going to be stigma, but getting the general person to understand that parents are doing the best that they can, and we need to wrap our arms around them. We need to wrap our arms around their kids, whether they're still with them or, they're with grandparents or they're with foster or adoptive families. They all need our support, and we can do better for them.
Great. Yeah, no. And I think it's not new, but it's obviously out of the opioid crisis. And you mentioned we've had people like alcohol exposed children. Like you've got it. We've had it for probably centuries, right, at this point. But this group of children and the work that we're doing is the just population is that much higher and that much more relevant right now, because that is what we're still in the midst of it, and we're still seeing it, and it's going to continue to happen. But so it's so interesting to the work that you do to continue to uplift, because if we're because this is so new and the research that you all are doing are changing and evolving kind of how we as a state look at this, how we as a state help these students and how we help these kids and these families. No, I agree. We have a lot of, working towards ending stigmas in a lot of our world. We've got the mental health stigma that we're slowly working on, but if we continue to do the work that you do and continue to bring this stuff to the forefront, it's going to be a part of who we are as a society. We're accepting. We're making sure that yes, so you were born this way, or you whatever. How can we help you? How can we make sure we're servicing you?
Yeah, and I think, we talk a lot about what these kids may struggle with, but I think it's really important to talk about all their great strengths and, to really capitalize on those and to make sure that they know that they can, with these early services and supports, these kids can do really, really great. I've seen it personally. I've seen it with my kids. I've seen it with my kids' friends. But we just need to make sure that they have access to what they need and that we're talking about it, because we're not talking about it enough.
Yeah. And that, so many times, and I don't know if it's this way, people don't want they don't want the diagnosis because it labels. It says this kid is going to look like this, which some parents don't want. So that must be a kind of something that you struggle with as well, to identify the parents who don't want to realize it or don't want to have their child labeled. But when you get labeled, you get so much more. Like what's available at the state level is just, you have to have a label, unfortunately.
Yeah, absolutely.
Yeah, no. So if you could, so we've kind of talked a little bit about like what the greatest opportunity is. What gives you the most hope in this work?
I think what gives me the most hope is that there's so many research studies that are out there that are showing the needs of our kids, whereas there weren't before. And I think that for those naysayers who think that there's no long-term needs for our kids, maybe this will allow them to start to talk more about it and to start, thinking about things in a different sort of way that, we need to be able to provide more for these kids.
Yeah, so you have the problem when they turn 3, you get the problem when they turn probably also 22, depending on the services that they need. Like so many other people, so many other diagnoses. You get that point where how and what do you need moving forward, because you wrap services around people from 3 to 22, and then after that, those resources are much harder to get depending on what you're looking for. So is there anything else you wanted to share with us today that, maybe we didn't ask or talk about?
No, again, I think just ending on the note of how resilient these kids are, how smart they are, what great friends they can be, and, how from an early age they've really had to work a lot harder than their peers. And that if we, think about some of the behaviors that we see in terms of, their brain, needing a different kind of support than some of their peers, I think that can be really helpful. But, we say that we don't want to give up on, parents that are in recovery or people in recovery and 100%. But I also, I think it's really important that we don't give up on these kids.
Oh, 100%. We can't. And thankfully for you and your organization, we're not. And with you continuing to advocate and the powerful voice that you have in the state, I think we're going far, and I'm really grateful. Thank you for taking time to be here and talk to us about this and just the incredible work that you do with To the Moon and Back. You are, doing the work to support the children and families across Massachusetts. It's really been an honor to have you part of this conversation, to work with you, to have you as a resident of the First Plymouth District, and all the work that you do. So thank you for spending time with us today, Theresa.
Thanks for having me.
Thank you. So my hope is that today's episode helped listeners better understand the realities of perinatal opioid exposure, the importance of meeting families with compassion and evidence-based support, and why early intervention is such a crucial piece of improving outcomes for children. As we discussed, when we invest early in child development, we not only change the child's trajectory, we strengthen families and communities for the long term. Thank you for listening to Legislative Lens, People and Policy. I'm State Representative Michelle Badger, proudly serving the 1st Plymouth District. Between episodes, you can stay connected with us on Facebook, Instagram, Twitter, TikTok, YouTube, and Blue Sky. You can also reach out to us to ask any questions or suggest episode ideas at michelle.badger@mahouse.gov. Thank you again for tuning into Legislative Lens, People and Policy. Have a great day.